Okay, so the first thing we're going to do is we need to find ideal positioning. And the more often you do this, the better.
Okay.
So here, you're going to bend both knees. And you want your feet about as hip width. And that looks good.
Okay.
And then, so about that wide. And then you want the knees about 90 degrees. And that looks pretty good.
Okay.
Then what you're going to do is that you're going to tilt the pelvis backwards and forwards. And you're going to do that 3 times. And then you're going to find the middle. And I want you, for our purposes now, to tilt backwards just a hair. Right there. Okay. Then hands at your sides. Think about shoulders being nice and wide. And then let me lower this a little bit. And then back of the neck, nice and long. So, yeah, perfect. Okay. So now, the powerhouse, a combination of 3 things. Breathing in a specific way, contracting those deep abdominal muscles, and then contracting the muscles of the pelvic floor. So first, the breath. Into the nose, out to the mouth, through pursed lips and tongue. It's going to look and sound like this. Shh, like you're telling someone to be quiet.
Okay.
Okay? Okay. So, no change in the bony position. That stays totally stationary. So again, breath in, and then just shh. Good. Awesome. Now, a transverse abdominis muscle. Take your hand, put it right there. So you feel the pointy hip bone. Roll just to the inside. So now, take a breath in, and then breathe out and try and draw that lower belly back towards the spine. Shh. Perfect. Exactly what we're looking for. Good. One more time. Shh. Good. Okay. Muscles of the pelvic floor. Heard of Kegel exercises. Exactly what we're going to do. So pelvic floor muscle sits here. Urethra, vagina, anus all pass through it. When you contract that muscle, it moves up towards your head. 2 cues to help people get connected to their pelvic floor muscles are 1, stopping a pee in the middle of peeing, but we don't want people to do that on a regular basis because that does promote urinary tract infections. The other one is holding in a fart. Can you contract your pelvic floor muscles?
Okay.
Awesome. Okay, so now it's breath in. Breathe out, draw in, lift up. Shh. So start with a little bit more of that posterior tilt. Okay, breath in, and then draw the lower belly in. Shh, lift the pelvic floor. Perfect. That's what we're looking for. Okay. So now we have the stabilization, and now we're going to add movement.
Okay.
So you're going to take that breath in. You're going to engage for 1 second, or you can go longer, but at least a second, and then you're going to bring the leg up into tabletop. So it's going to look, yes, it's going to look like this. Shh.
Okay.
Shh. Show me. And just to 90, so a little bit right there. Yep. Okay. And then engage and bring the leg down. Same thing, other side. A little bit longer engagement before the motion.
Okay.
Good.